These are some of the health workers who responded to the Ministry of Health's call when an outbreak of Ebola was announced in September. They were needed to back up the few personnel in the districts of Mubende and Kasanda. Majority of them were deployed to the Ebola treatment units.
They bring you in a soft way, promising you very many entitlements. After responding, zero.
They were promised a salary, a risk allowance and per diem to cover their daily expenses.
So all these were promised, and even contracts came, though they came late, suggesting a salary that is supposed to get, trying to honor their verbal promises.
3 months later, restrictions in the affected districts have been lifted. The country is on the cusp of being declared Ebola-free, but the doctors say the ministry has not fulfilled its commitments. They say that instead, the ministry ordered them to leave Panorama Hotel, where they have been living, and return to Kampala.
And it is so shameful that the pressure is upon us because Christmas is coming around the corner, and they have not given us money.
They accuse the ministry of taking advantage of them and their skills.
We went to the university, did a medical degree, and we are now being used as outbreak responders, and after that period you are dropped.
The health workers added that there are officials who are also pressuring them to pay 85,000 shillings in accommodation fees.
Everyone knows her bill, what he has been consuming and what he has been doing, and people are actually not comfortable with that, and I think we should come into agreement and conclusion.
They insist that they will continue camping at the hotel until their monies are paid, and if push comes to shove, will involve President Museveni.
When we are giving medals, we shall have to give the medical staff also, as we normally do. Because in this war of the Ebolas, of the coronas, they are always on the front line.
Back in Kampala, the Ministry of Health said that all funds for the Ebola health workers were paid into their personal accounts. According to the spokesperson Emmanuel Ainebyoona, the workers were recruited under 2 batches and each has been paid differently.
There are those ones who began earlier. They received part of their payment, and if they continued up to December 6th, they will also be paid. The only people that might have not received the pay among that cohort, the batch that started early, had a challenge with the discrepancies in names and accounts and phone numbers.